All right, welcome everyone. Thank you for joining us and coming back. I hope you had a good stretch and maybe you got to see some sunshine during your lunch. We're going to give it just a minute for people to join us and we will begin. Michelle, you want to give me like a thumbs up or something if you feel like people have been able to join? I can't see the list. Looking good? Okay, awesome. Well, thank you everyone again for coming back and joining us for the NAMI New Hampshire Annual Conference. Hope brings us together. My name is Kimberly Somariva. Michelle Watson and I coordinate the annual conference. We're thrilled you're here. As a mom of five myself, I'm elated that we're covering this topic at the annual conference this year. Advocating for maternal mental health. We have two fantastic speakers to present today. Nancy Glynn is the campaign director for Moms Rising New Hampshire. She's a mom, an activist, and she's also a Navy veteran. She's been advocating on behalf of New Hampshire families since 2016 and has a true passion for disability justice, women's rights, and healthcare advocacy. In her free time, Nancy loves to push herself to run further than she has ever run before and participates in road races and obstacle course races on a regular basis. She lives in Sutton, New Hampshire with two dogs, Carl the cat, her partner, and their Ninja Warrior son. And Heather Martin is a passionate maternal mental health advocate. She works with postpartum moms at Dartmouth Health Pediatrics after successfully launching a postpartum screening workflow for mothers in the pediatric practice. Heather is also a postpartum support coordinator for the state of New Hampshire. She became passionate about maternal mental health after losing her only sister to maternal suicide over a decade ago. More recently, Heather has been advocating for legislation regarding maternal mental health here in our state and on a national level. She feels advocacy and spreading awareness for maternal mental health is essential to keeping our moms and families, to helping moms and families who are in crisis. And you guys may know that May 3rd, Governor Sununu signed a proclamation in recognition of Maternal Mental Health Day. This was due in large part to Heather's advocacy efforts in our state. And Heather didn't get a heads up on this. So hopefully you don't mind surprises, Heather. But we really want to recognize your tireless voice, and you have been selected for the NAMI New Hampshire Volunteer of the Month for May 2023. So we had the privilege of honoring you for that. And particular Heather volunteers for the NAMI New Hampshire Survivor Voices Speaker Program. So congratulations. Thank you guys both so much for being here.
Thank you guys. What a wonderful surprise. I really appreciate NAMI New Hampshire. They really have helped, spread advocacy for this issue. I had contacted them probably about a year or two ago and had asked, hey, what are we doing here in the state of New Hampshire for maternal mental health? It just went from there, and I met with Holly Stevens at the State House and testified in front of legislators about the importance of mental health, and we'll get into that with the presentation. But NAMI New Hampshire has been so supportive, and there's so many great people that work here, and I'm extremely grateful. So thank you very much. I appreciate that. So I'm so excited to be here with my friend Nancy Glynn, and we hope to share our stories and to inspire you or someone you know or friends to share your story about maternal mental health, because we know it's the number one issue affecting mothers here in our country and across the world. So that's what we hope to do with this presentation. Here's me. I work at Dartmouth Health Pediatrics, like Kimberly had said, and past 3-4 years been working with our mothers there and doing screening for maternal mental health, anxiety, depression, and then following up with them, making sure they're seeking mental health help or support groups. And I also work with Postpartum Support International as a coordinator for New Hampshire. We have 3 others with myself, and you can call a helpline. We'll get into that, a national helpline, and they connect you to us if you live in New Hampshire, and we'll connect you to mental health help and resources. So extremely important. And more recently, I've been working with the chapter that we that has really, has really gotten a good, I don't want to say start, but like restart. We're trying to really build the chapter and the resources and make connections to help our mothers. And I volunteer for NAMI New Hampshire, and I want my friend Nancy to introduce herself. Amazing superhero over here.
See, I was thinking the same thing about you, Heather. I was over here going, really like not surprised at all in regards to how strong you are in your advocacy world. You are a superstar. So congratulations for being nominated for that. That's awesome. Well, anyway, my name's Nancy Glynn, and I'm the campaign director for Moms Rising. Moms Rising is a nonprofit organization. We work across the country, but we do have some state based groups, and New Hampshire happens to be one of the states that has a chapter here. And we work on different kinds of policy and different kinds of issues that affect moms and families. And clearly maternal health and maternal mental health is a huge part of that. I'm a mom first and above all. I'm also an organizer. So I work with moms across the state and make sure that their voices are heard in regards to the stories that they have and the things that they're struggling with, and also lifting up some of the good things that are going on. So we can make sure that the people that are in those positions to make change happen know exactly what's going on, because a lot of times they don't. So, and I'm also an activist. You have to have a fire in your belly when it comes down to some of these issues that we work on, and they're not always easy to work on, especially when we're talking about maternal mental health. But at the end of the day, it's the fire in our bellies that get us moving.
So we wanted to share our stories because I really think that's what drives our passion, and so many people around us, their passion. My passion for maternal mental health came after losing my only sister to maternal suicide almost 14 years ago this month. She gave birth to my niece in 2009, their first child. And she became withdrawn, just not herself, within a week or two postpartum. Had an amazing birth, amazing pregnancy. Definitely did not expect anything like this to happen to my sister. She was just an amazing, beautiful soul. And just our family and I had no idea that something like this could happen. And so she became withdrawn, and within 2 to 3 weeks postpartum, she admitted herself to the emergency room at the advice of her doctor, and checked herself out after a couple days because she just did not feel like that was the place for her. It was not the place for her to seek help for her maternal mental health crisis. And within a few days, she died by suicide at her home. So that has been the driver, because the same issues still exist 14 years later, that there is a lack of community support, lack of mental health help. We are working on it though, here in our state. We are working very hard, working with all different community health centers, mental health help, Postpartum Support International, all of these pieces we're working on so that this doesn't happen to another mother, because as we know, things that have been happening in the news the past couple of months, these things are still happening. Just the tragic ones come to the spotlight, and we want every mother to be heard and to be helped. So that's my story, and I'll turn it over to Nancy, and she can tell you what drives her passion.
Thanks, Heather. So I am the mother to 2 boys. My first son, Hunter, and he's my Ninja Warrior guy. He was born 8 weeks early. He was 2 pounds, 10 ounces when he was born. It was my first pregnancy. I was 23 years old, and it was one of those situations where like, I wasn't sure what was going on with my body. I wasn't really sure what was happening. Like, is this, what's normal and what's not? And he ended up being in the NICU for quite a while. And he also has some chronic health conditions today. And, just that whole experience of, having a baby and not being able to bring your baby home, and then bringing your baby home and being that first time mom and not really knowing, what to do there. That was kind of where my brain started kind of ticking a little bit in regards to, what are the kinds of things that, moms need to be supported. And then my second son, Sawyer, he was born back in 2015. And he was also very, very premature. Unfortunately, unlike Hunter, Sawyer passed away. So what you actually see in that picture there is me holding my son, who had passed at this point, and just trying to memorize every little piece of him. I was put into the hospital after having some complications, and I wasn't sure what was going on other than them telling me that I was on bed rest. And one morning, the doctor came in the room and basically said, you have a choice. You can have the baby now, or you'll most likely have a stillborn by morning. And, when you're given that kind of an ultimatum, there isn't really, it's a no-brainer in that situation. So we ended up going for delivery, and Sawyer was born. He was really, really tiny. He was under 1 pound. And, he was having difficulty breathing. They couldn't intubate him properly. And when they came over and they basically just said, we can't keep the tube in. And I'm laying there on the table, emergency C-section, and I'm yelling at them, what do we do now? And nobody could respond. And my husband actually then said, hand us our son, make him comfortable. And, Sawyer was handed over to us, and, we held him until he passed. And, that's one aspect of maternal mental health that a lot of times isn't brought up is, what about the moms that have lost? And we know that there are many of us. All right. I know I'm not alone in this world when it comes down to that kind of a loss. But I was on Medicaid at the time, and I didn't have, I only had access to healthcare for 60 days. And actually mine was pushed out to 90 days simply because I did have that C-section and I did have some complications. It took me at least a month before I even felt comfortable going to see somebody to talk about what had just happened. And as soon as I started to get comfortable with that therapist, I was told that my insurance was running out and I no longer could go and see them for therapy. And, I'm fortunate to where I do have some pillars of strength in my life that I'm able to reach out to and, be able to talk. But ultimately, there are still a lot of those demons that, I'm still facing today and every day. And sometimes I often wonder, would I be in a different situation today if I did get the help and support that I needed? And knowing that that was my story, that was what happened with me, made me even more motivated to be able to go out and speak in regards to access to maternal health care, and especially in regards to access to maternal mental health care. I'll hand it back over to you, Heather.
Thank you, Nancy, for sharing your story. I've heard it before, but every time you tell it, it really strikes me. Going to a convention this past fall, that was a huge topic, is that there's not a lot of support from others who have lost, and they kind of just get forgotten about. And, you know, we need to make it, we need to make it so that doesn't happen. So I appreciate you sharing your story. So what is maternal mental health? So we talk about maternal mental health, we talk about perinatal mood disorders. So that means pregnancy and postpartum, because a lot of the times you hear postpartum, women can have symptoms of depression, anxiety during pregnancy. So it's not only postpartum, it can be during pregnancy. And the common terms that we hear are depression, anxiety, OCD. More recently, we hear about psychosis, and symptoms can occur for up to 1 year postpartum. It doesn't just turn off after your 6 to 8 week checkup at your OBGYN. It can, you know, symptoms can last for up to a year, sometimes longer. So that's why the Medicaid expansion here for our state in New Hampshire, we need to cover our moms for up to a year. And it's more common than we think. I feel like the past couple of years, you know, really doing a lot of social media, stuff like that, people have come out of the woodwork to tell their stories because, you know, you make it okay to share. So we need to continue to share our stories. 1 in 5 mothers will suffer from a perinatal mood disorder, and less than 15% will receive treatment. And that doesn't always include medication. We're talking about therapy. We're talking about just help seeking in general. And it's the #1 complication of childbearing. I mean, we need to help our mothers. Generalized symptoms of a perinatal mood disorder, persistent worry. We could go over all of these. The big one that we ask our moms a lot is having little or no interest in the normal things that you do every day. That's a huge symptom. Withdrawing from friends and family, lack of sleep, having that lost look on your face, huge red flags. CDC shocking data, 53% of pregnancy-related deaths occur between 7 days and up to 1 year after pregnancy, and 4 out of 5 maternal deaths were deemed preventable. That is huge. And they said over 80% were preventable. So in a 2-year study, the #1 cause were suicide and drug overdose were the top causes of maternal death here in our country. And pregnancy-related deaths among women of color, 3 times the rate of women, or is it twice? 3 times. I think maternal mental health conditions is 3 times with women of color, and then death twice as high as white women. So we are not doing good when it comes to women of color. Maternal mental health crisis. We've been hearing this for months now, and more recently, the spotlight has been about postpartum psychosis after the Duxbury tragedy. Lindsay Clancy. This should not. We did spread awareness with maternal mental health disorders or perinatal mood disorders. We did spread awareness, but there was some messaging that was not the right messaging, that she was a criminal. She had a mental health condition that, you know, should not be criminalized. And the more that we criminalize these mothers for having an illness, the more women are not going to come out and speak out because they're afraid. So we need to make it okay for mothers to speak out and to share their stories and to share what they're going through. We need to make it okay. And we need to make stories like this, you know, attract attention, but not the attention that she's a criminal. So that really touched home when that had happened in the maternal mental health community, because anyone that has worked with mothers with maternal mental health knows that she was suffering from psychosis. What we can do, this is a lot of questions that we got before this session today: screenings during pregnancy, postpartum, screening helps prevent, and we're more aware in the conversation. We open the conversation about maternal mental health with screenings, and most huge advocate for screening in the pediatricians. That's where we see the moms, right? We see the moms one time during their follow-up OBGYN, then that's if they have a healthy pregnancy and childbirth. But we see the babies with their moms and families. It's not just about the moms, it's opening the conversation to families, the dads in the rooms, other caregivers in the rooms, recognizing the symptoms and what to do if you're struggling or your partner's struggling. Check on mom. I tell this to everyone. I scream it from the rooftops, not just the baby. Check on the mom, meal trains, do some errands, just go over and do housework. Don't let her, she's not going to ask for help sometimes. She's just worried about the baby, worry about all that other stuff for her. Fourth trimester planning or planning during pregnancy. We don't talk about this, perinatal mood disorders. We don't, because there's shame involved and stigma. So if we can talk about it during pregnancy, we can talk about it postpartum, what your plans are, who's going to help you, who's there for you. If I tell women, if you have to sit down, or moms, sit down and name off everybody in your life that can help you, they'll be surprised of how many people that they have on their list. Because, they're always feeling alone postpartum, right? Because everybody's focusing on the baby. But if you have it all written down, it sounds like a simple thing, but if you write it down, here's the people that I can trust and talk to. And we need to give our moms the tools and the strategies to manage stress and anxiety during pregnancy and postpartum. And we were talking about this before we came on this session, untreated depression has a major impact on our children. They've done a lot of studies, within the past 5 years that have shown that moms with mental health, even during pregnancy, perinatal mood disorders can affect the child's health, emotional and social impact, developmental delays. They have done studies that have proven that there is a major link. And what we can do, we need to normalize maternal mental health disorders and reduce the stigma, spread awareness for not only moms, but families, anybody that's taking care of mom and family. Check on mom. How are you feeling, mom? Big one that my friend Nancy's going to talk about this. We need more policies that support our families. So many different pieces of the puzzle that we need to work on for our moms to be okay mentally. It's not just if they have a perinatal mental health condition, but childcare, paid leave, there's so many different pieces of the puzzle that we can work on. Better access to mental health treatment, especially here in our state. They just came out with report cards for maternal mental health in our state. And we in New Hampshire have an F for a score. We don't have enough mental health providers for the amount of patients that need to access mental health treatment, or peer support groups. We don't have enough groups Home visiting is a huge one. Doulas, we don't talk enough about doulas. Everybody should have a doula. There's just so many different pieces that we are working on, but we have a long way to go to get that grade up. And I'll have Nancy take it over because she can tell you all about this advocacy work that we're doing here in this state and across the country. Thank you, Nancy.
Thank you, Heather, for sharing all those details too. I think it's really important that we keep talking about it. So advocacy. All right. My advocacy journey began when I became a mom. So naturally, finding organizations and places to go to that, really walk the talk in regards to what moms and families need was really important to me. And I'm just gonna kind of get real for a second. And I just want everyone to take a moment. And I want you to think about any kind of time that you might have seen a mom stressed. All right. Or how are moms typically depicted, say on television, via cartoons, via comic strips. How are moms usually depicted? Because I can tell you with my job and going around and talking with moms and meeting with moms, all right, the number one thing I hear from moms is that they're tired, that they're stressed. And more often than not, when people go over and talk to them, they're asking about the kids. Nobody actually dives in deep to ask about mom. All right, the moms that can't remember the last time they brushed their teeth, or the ones that managed to skip breakfast and lunch, but make all of the meals for the kids and the rest of her family, but forgot to eat herself. That mom who, and actually this isn't just a mom, this is just a stressful problem of how many times did you put that coffee cup in the microwave to reheat your cup of coffee that you had that morning, right? When you're thinking about all those pieces and you put it all together, you can kind of better understand, where moms are, how much they carry on their plate, and also, realistically how, society views moms, that this is just how we're supposed to be, but we're not supposed to be this way. And I think it's really important to kind of just start there. Heather, could you go to the next slide? All right. So when it comes down to things that we can advocate for, all right, we have a few things that is going on federally, and I'm going to touch base on some things that are happening stateside right now. So for some new federal law, the Triumph for New Moms Act was passed. And that one promotes federal collaboration between agencies and departments by creating the first ever National Maternal Mental Health Task Force. The work of the task force will be to identify, evaluate, and make recommendations to coordinate and improve federal responses to maternal mental health conditions. I'm gonna outline this. The United States was one of the only countries in the world that was not tracking this. And we are now just tracking it. Unfortunately, it took the United States to be the worst in regards to maternal health for them to actually start looking into this. And it's huge. It's definitely a step in the right direction. But we also know that passing a law isn't the end game. It's also implementing the policy itself. So this is also something to think about in regards to something that you might want to advocate for. Another federal policy that just came to light was Into the Light for Maternal Mental Health and Substance Use Disorders Act. And that one establishes and funds a dedicated national maternal health hotline to provide 24/7 voice and text service. So you heard Heather talking a little bit about that hotline earlier. Here's some information on that hotline, a number that you can call or text. It's free, it's confidential, and it's available 24/7. So, if the only time that you have available, or, a mom has available to be able to call that hotline is at, 2:46 a.m. after they had just put their babies down after a feeding, and they just need somebody to talk to because they're overwhelmed. This is a resource for them that they can absolutely use, and I hope that they take advantage of. I'm also going to say one other piece of federal data and this is like the newest data, guys. I heard this yesterday. So to date, 33 states and Washington, D.C. have already extended their postpartum Medicaid coverage. And there are 10 others who are planning to implement the change. And New Hampshire is the only state in the Northeast that hasn't expanded postpartum healthcare coverage for low-income pregnant people. All right. Let that sit for a moment. So this session, we introduced the Senator Becky Whitley introduced the Momnibus, all right, which helps to address a lot of the things that we need to support moms in New Hampshire. So one of the first things is that Medicaid coverage for up to 1 year postpartum. As I had mentioned before, the current policy offers coverage for 60 days. And in my case, this is something that would have benefited me greatly because I would have been able to obtain some more of that mental health care that I needed. Ensuring that Medicaid coverage of donor breast milk, lactation services, and doula services. I know of some families and talking with other moms in the state where they're paying an arm and a leg to get some donor breast milk for their child. And it's something that's all that they can have. And it's a huge struggle. I know one of the families I spoke to, they drive an hour and 45 minutes one way to go and pick up donor milk, and they're paying out of pocket in addition to that. So having Medicaid coverage to be able to help with that is huge. Lactation services. Again, first-time moms don't necessarily know exactly what's going on. And we know that throughout breastfeeding, there's a lot of times that, we run into situations that we're not really sure what's going on. So being able to have access to someone to do that is huge. And just like what Heather said before, everyone should have a doula. All right. And the way that it's positioned right now is, families on Medicaid have no choice. They have one choice. That's it. And that is to go that traditional OBGYN route and not to have a midwife or a doula to be able to be there. But, I believe that moms should be able to have the choice as to what's going to make them feel the most comfortable. Establishes minimum workplace supports for nursing moms. And invest in family resource centers that are working to improve maternal and child healthcare outcomes. Visiting nursing is one of the biggest pieces that comes out of these family resource centers. And I know that I had visiting nursing for my son because he was premature. And I can tell you that it was just so helpful, and more moms need access to that. So the update on the Momnibus right now is that the Momnibus was tabled in the Senate after unanimous support in committees and the full Senate. This is common practice during a budget year. The Senate often tables bills that have appropriations, money attached to them, and then includes them in the budget bills. This is huge, and this was not a small project. Heather was very active in getting this pushed through by sharing her story. There are lots of moms that came out and shared their stories as well. Next slide. So, destigmatizing maternal mental health starts with sharing our stories. All right. And it's really important because one of the things that we had mentioned was, how is a mom depicted? And when a mom is depicted to be tired and to be stressed all of the time, all right, we know that there's a problem. We know that you're also not alone in feeling that way. So not only do we need to share our stories, on a policy level, in our communities, as well as with our friends and family, we need to keep talking about this. We need to keep sharing our stories so then we can make sure that this is no longer a stigma. And in fact, we are doing everything we can to support them. So on this page, there's a QR code. If you scan that QR code, it's going to bring you to an action page that Moms Rising has put together, for folks to be able to share their stories. And, there's a lot of different ways you can do this, and you can do it anonymously. You can also do it, with your name present. It's up to you. And we'll definitely meet you where you're at. And if, sharing it this way isn't the right way for you, then you could reach out to Moms Rising directly, myself, and I can definitely chat with you further. But sharing these stories and getting them on a platform where people can hear them and understand is huge. Next slide. We heard about the amazing May 3rd was proclaimed Maternal Mental Health Day in New Hampshire. This is huge. And this is also something that no matter what, every single year we'll be able to look back on Maternal Mental Health Week as well as Maternal Mental Health Day. And, remember that, hey, we're still supporting moms, and we're still amplifying these stories, still amplifying those voices. Next slide. So you saw a variety of different things in our presentation today. So these are some of the lists of the resources of from the information that we had shared with you today, some of the statistics that were shared, as well as just some great resources that are there. And if you have any additional questions, after our time here today, please do not hesitate to reach out to Heather and myself. We have put our emails as well as our phone numbers on there as well. And feel free to reach out, because this is an issue that, again, both of us have that fire in our belly for. And, we're looking forward to being able to continue this fight. And we hope that you'll be alongside with us. All right, should we switch over to Q&A?
That sounds good. I've got some questions. We had a lot of questions come in ahead of time. And I know you probably touched on some of these already in your presentation. So let's see. Do you know of any support groups in New Hampshire that focus just on maternal mental health?
There are a few, and we need more. We're working on that. But if anyone is looking for support groups in New Hampshire, they can go to postpartum.net and they can contact one of us support coordinators, and they kind of hone it down to what area of the state that you're in. And because there are a lot of in-person ones again, that a lot of them went to Zoom during the pandemic, and a lot of them completely, they stopped doing them during the pandemic, which was really harmful because our moms struggled the most during the pandemic. So, you're able to go to that Postpartum Support International site, postpartum.net, and then get connected that way. But yes, we do have some peer support groups, some support groups that are dedicated to postpartum, but there's very few. And also at that postpartum.net, there are virtual groups. So, but they're amazing because they have all different categories, women of color, single mom groups. There's so many different groups that target different moms. There's dad groups on there, because it's not just moms, dads can be affected. 1 in 10 dads can be affected. So postpartum.net is a huge resource for groups to find a group. And we're also at the state level, working as a chapter, we're honing in on all of our resources. So it's a work in progress, but we are making progress.
Thank you. Here's another one. Do you find that postpartum struggles apply more to first-time moms, or can it be moms who have had more than one child, or just moms in general?
You want to take this one, Nance?
Yeah, this affects, there is no demographic of folks that this affects more than others. That it's across the board. It doesn't discriminate against, any of it. So, and actually I would say, a lot of times the moms that are struggling a lot are often ones that have multiple children. Simply because they're past that what do I do phase. But now they have the added additional family member that's in there as well. And they're often the ones that are even more likely to be put onto the back burner because they're not now taking care of the whole family, and they often get left out of that conversation. So if you see any mom for that matter, then I would definitely walk up and I would say, how are you doing? How are things going with you? Because that's kind of the first step to be able to see, you know, what kind of support this mom might need.
Do you think that medical providers are doing enough to screen for postpartum depression? Is there any follow-up after a mom leaves the hospital?
Where the whole screening, I don't know the percentage, but it's low. The screening percentage is low, and that's part of our failing grade here in New Hampshire, is we're failing our mothers with screening. And the screening process that I started at Dartmouth is not mind-blowing. We're supposed to be doing that. American Academy of Pediatrics recommends that we do that at certain intervals in the baby's first year. So it was the whole follow-up process is what made it great too, because you need to do the follow-up in order for the screening to be successful, right? You know, a mom screens positive, what are we going to do about it, right? We have to have the resources and support to back us up. And we need to call them in a week or two after they screen positive to see if they've contacted someone. How are they doing? Because it's just a piece of paper at that point. We're not really serving any purpose if we're not. But screening, yes, you know, they do get screened in the hospital and screened postpartum. And during pregnancy, they do it, but you know, it's not as often as we should.
And I'm also going to raise up if that mom made it to the appointment. Because I know that I was guilty of it myself, but I know of a lot of moms that didn't even make it to that postpartum appointment. You know, they are completely wrapped up in what's going on, and they whether missed it, forgot to reschedule it, or heaven forbid they're on Medicaid and it runs out and they no longer have the chance to go.
Absolutely.
And you touched this briefly, Heather, but what ways do you recommend that a family member approach someone to offer them help if they see them struggling, but you know, trying to be mindful and not isolate them further at the same time?
We always say like, ask them how they're doing, but ask them. I learned this from my friend Steve at Survivors of Suicide Loss training. He learned it, and then it's instilled in me now. So ask the mom more than once, right? Not just one time. Ask her again, because even just in general, asking someone how they're doing, right? You say, I'm okay, you know, the usual response. But then if you slow it down and you say, no, how are you really doing? How are you doing emotionally? What can I do to help? And it's okay if you need help. You're not a bad mom. I hear that so often, that moms feel like they're failing their families, their babies, or themselves, their expectations of motherhood in general, that they're failing. So we need to tell our mother, you're still a good mom if you need help. So that's huge. Like I said, I hear that constantly. I talked to a mom or an aunt last week. She's driving up here from South Carolina to visit her niece here in New Hampshire. And she said, what can I say to her? I said, tell her she's still a good mom, that she needs help. She was driving up here to help her niece. She had no support system. How awesome is that? But she was like, wow, she said that. I feel like I'm a bad mom. I said, yep. And I hear that so much of the time.
I think that positive affirmation is absolutely important, you know, and I'm also going to bring it to a level where, you know, have you ever worked in a group and there's somebody in the group that just never asks for help? So making sure that you're asking multiple times, giving more opportunity for them to be able to ask for help, because I know that we've all most likely been in that situation. We've also been in a situation where if we needed help, the amount of time it would take for us to describe how to do it is longer than if we just did it ourselves. And that is a mantra that so many moms have in their brains, because you have so much time to get all of the things done, and, so little time to do it. So I think asking multiple times and giving that opportunity is huge. And that reminder of, hey, you're doing great. Hey, you're, looking around, no judgment whatsoever. Give them a hug if they're okay with it. Tell them that you're proud of them. Those are some of the things that a lot of times moms are not reminded of. And, and unfortunately, once kids are past a certain age, they stop telling you this. And when they're babies, they can't yet. So just having that there and that reminder is huge.
And another big thing that I tell moms all the time, get outside for 10 minutes even if you have to drag a mom outside, 10 minutes, go outside, take in fresh air, especially now. I mean, I feel like people are going to start feeling better with this whole seasonal thing and the sun shining. I tell them, go out for 10 minutes, give her that break, even if it's just on her own without her baby. It just makes a world's difference just to be outside, fresh air, or take a drive if they're able to. Take a drive and just, get out of the house.
And acknowledging that self-care looks different for every person. And a lot of times the way that, self-care is depicted is things like, oh, going on a shopping spree, going to get a massage, going to get your nails done. No, sometimes that self-care that all that mom really needs is just a moment to shower. Maybe actually stay in the shower until the hot water runs out, or getting in the shower where there is hot water. I think those are some of the big pieces that a lot of times folks overlook, that sometimes even 15 minutes, 20 minutes is enough to be able to help that mom feel supported and, help her recognize that she is moving forward and she's doing a great job.
One of my favorite quotes is, like, I can't remember exactly, but if mothers could learn to do for themselves what they seek to do for their kids, everybody would be a little happier and treat ourselves a little more gently. Let's see, we have so many questions. You talked about this a little bit already, Nancy, but is there a way for people to offer resources directly to women, like if they're a childcare provider, or if they want to share something in their WIC office? Is there anything we could physically give people as a resource?
We're working on that as a PSI chapter. We actually have a resource roundup coming up next week, and we're pulling together so many different resources, because like I was saying, there's so many different pieces of the puzzle, right? It's not just about healthcare, it's about community resource centers, WIC offices, home visiting. There's just so many different pieces, groups, so many different pieces of the puzzle. So we are currently, as a chapter, you can reach us through Postpartum Support International website, that postpartum.net. As a chapter, we are working on a list of resources, and for the area of the state that they're in too, because we are like a small state, but then it's big when it comes to providing resources, right? Because we have the Upper Valley, we have Central New Hampshire, Seacoast, Southern. So we're working on all the different areas of the state and compiling our resources, and it's been a big process, and I have some amazing people that are doing this, compiling this, and we're working really hard to pool all our resources together. And the more we do it, the more we reach out to different places, the more we're learning about different resources. So more to come on that. And I feel like if you're a place like a WIC center looking for resources, that postpartum.net, go into the New Hampshire chapter, you can actually like click on the state and like getting resources that way. But yes, it's a work in progress.
And if you're looking for an advocacy point of view, another thing is a lot of times groups, I know Moms Rising, we do this, where we have maternal health talking points and things like that. That way you have some kind of data or something to build a conversation off of, which that's what really needs to happen. So we need to have more discussions. We need to be talking about it more. So I can say that there's that, reaching out to some of the different kinds of advocacy groups, that work on maternal mental health would be huge. And we need the voices, we need the stories. So if you're looking for that avenue of resource, those are available too, also, in addition to this amazing thing that Heather's talking about having a compilation of all the different resources that we have available. We actually had a talking point document, but the one I had for Moms Rising was like from 2017, and all of that's just irrelevant now after the pandemic. Everything has just been blowing up after that. So.
Well, thank you. I want to be respectful of your time. I know we've gone over just a little bit. There's still some more questions, maybe if you have a minute to pop in the Whova and just see what conversations people are having. And we're happy to keep chatting about this. I've shared some of the things in the chat, and I'll add more and upload these slides so that folks can view them in Whova as well. Did you have any closing thoughts, ladies? I didn't want to give you a chance to say anything else that you might have.
No, I just want to thank NAMI New Hampshire for really like recognizing this topic and really working hard to spread awareness here in our state. So thank you. And I want to thank Nancy. She's totally awesome superhero, and I'm thankful for getting to do this presentation with her.
Oh, thank you, Heather. I appreciate you so much. Look, we have Maternal Mental Health Day. All right. And a lot of that has to do with the work that you've done. So I appreciate you so much. My closing thought is this, when it comes down to having children, it's not always sunshine, rainbows, and unicorns. There's a lot of trauma that often is there. Share your birthing story, and talk with one another, and, know that you are not alone in this. And if you ever want anyone to talk to, you want to have that fire in your belly too, and start going and storming castles to ensure that we make changes on maternal mental health, then contact me and Heather, and I assure you, we will bring you up on our team. So thank you all.
Thank you.
Liz, will you pop up that closing slide if you're able? Thank you guys. Thank you both so much. And like I said, we'll keep this conversation going. We'll share the slides over in Whova. This presentation was recorded. It'll be available for 30 days in Whova, and it'll be on the NAMI New Hampshire YouTube afterwards. So you will be able to share it with folks, even use this as a part of your huge packet of resources that hopefully we can give to moms that might need it and the people who love them. We have our next workshop coming up is called Choose Love, and it's about creating safer, more loving communities. That starts at 2 o'clock. So thank you both. And thank you everyone for being here and for caring about this important topic.
Thank you.
Thank you all.
Thanks a lot.